Welcome back. You know, I keep telling you that you should actually have the show running during break. And when it's on, you should be on break. Because the things that I've heard the past few minutes, I just hope that they can repeat them. I'll try my best. So we're talking about the health services in the counties. I told you that there's that new way of doing things at the counties, getting medical equipment under the medical equipment service, where there will be a fee for service. So how it works is that ideally, the county identifies that we need a CT scan, for instance, Moronga County. Then there are some suppliers who will deliver it at no cost, but you'll pay them from the service that they offer. So will they manage it?
First of all, let's realize that, first of all, the services that county offers also provide part of their own source revenue. Yeah. So whereas that the services is being offered that you're giving us equipment on lease, then it also means that the county is also losing revenue, because then this money is being taken out directly now to go to the private sector of the person who is now providing that machine.
So let's assume a scan costs, let's say, 2,000 shillings.
Yes.
And SHA settles that, or the patient pays for that.
Yes.
So how do you share the 2,000 shillings?
It's based on the agreement as of now is at 45%.
45% goes to?
To the private owner.
To the supplier?
Yes, to the supplier.
And then the remaining 55%?
Yes.
The 55% remaining?
The 55% now belongs to the county, and it also includes now servicing that machine.
Servicing the machine. So you're supposed to finance.
And the consumables the county provides.
It is you to finance.
It's the county to finance.
Yeah.
With the remaining percentage, the county financing servicing the machine, the consumables that belongs to the machine, the power that goes to the machine, as well as the technician who is supposed to provide that service.
Okay.
Profit.
Yes.
That's fine.
There is no profit. The county provides services at a subsidized price, because the reason why we provide subsidized cost of services is because our people at that level cannot afford the sum of the services that for example, and I want to you go to hospitals, for example, MPSHA, for example, the cost of, for example, an MRI or, for example, a CAT scan that is supposed to do the abdominal is around 35,000. That's a cost, for example, of one service that is being provided. That cost includes all the consumables, includes the technicians and everything else. But the county level, if we are providing a CT scan of a similar amount, maybe it could be 15,000 or 12,000 or thereabout, which is supposed to be sorted out by SHA if a person has insurance. If a person doesn't have insurance, then that's an out-of-pocket cost that goes into it, which means that the cost that we are providing for Mwananchi is a highly subsidized service.
But is it sufficient to cover the cost of that service?
Now that still remains to be seen, because previously, because with the current negotiation, I'm not quite, we are yet to see how it's going to function.
All right.
But previously we had that challenge, because the equipment in the previous administrations, the equipment that we found under mess, we found that those equipment, we could barely afford to pay for those services.
All right. That's okay. Senator Manzo, so if it is the national government, Minister of Health, that has partly negotiated this, of course, with the support of the Council of Governors, so who will oversight this? Is it the National Assembly or the Senate?
First of all, it was not negotiated. It was forced on the governors. You know what a presidential directive means, and then when you seem to resist, then you are twisted into it. And finally, the common Mwananchi suffers.
So it's possible to do that 15 years after the Constitution?
Sorry?
It is possible to untwist governors 15 years later?
Yeah. It's very possible. There are many ways it's done, you know, even from the political party which sponsored you. you are likely to be twisted big time. But
from the money you receive. From the
money you receive. Maybe. Because you see, like...
That's what happens in Wiper.
Like, no, we have not yet formed government, but we will soon do. I'll tell you what happens. An average scan in Kenya costs 15,000 shillings, an average scan. And very few people can afford that. And when it comes to oversighting, first of all, there is a national, there is a committee of health, both in National Assembly and in the Senate. The one in National Assembly is supposed to do appropriation mainly and oversight the national government mainly. But the one in the Senate is supposed to oversight the operations at the county level.
Yeah.
And with the interference of the national government with quite a number of things contracted at the national level, you find it is very, very difficult to oversight. And that's why the Department of Health has been having challenges at the devolution level because of these national activities which affect them directly.
Yeah.
When there was a procurement of a system for 104 billion, which I believe we are still paying for, first of all, it never went through tendering. It was just, you know, procured without following the law. And now everybody in Kenya has to be forced to fundraise 104 billion. You know, in one way or another. And then when it comes to the claims, not only these national government hospitals, county government hospitals, but also the faith-based hospitals and the private hospitals. There has been a big challenge when it comes to claims. And therefore, you see health services, the government is assisted by the health-based hospitals. But the moment you don't pay them, if there is even a problem paying a government entity like a county, and then a county hospital, then now you have the health-based hospitals, then you don't pay them, including the private hospitals. Most of them are rejecting SHA. If you are on SHA, sorry, we are taking cash. You just go look for a hospital which can accommodate your insurance, or we are dealing with other insurances, not SHA. And then you find that the faith-based hospitals then collapse. And then the health services become more expensive for common Kenyan because they are also not available at the government hospitals. Simple things like scan, whereby by the time many people go to scan, they've had an accident and they need urgent medical attention. And therefore, there is a problem in the whole system. It needs to be relooked. It doesn't seem to be getting better, including now the so-called fraudulent claims. And again, also, when SHA says there's a fraudulent claim, they shut down your hospital for 90 days, they conduct investigations, they do a letter to you, then after 90 days or 60 days, they find you did not make a fraudulent claim. What is this private hospital supposed to do? It's supposed to sue SHA. Because it's a suable organization for negligent decisions. And then at the same time, let me finish on this one. You have not compensated the faith-based hospitals, and therefore you make it very difficult, you know, for patients in the country, of which the health profession which is devolved should have been, you know, should have made a Kenyan enjoy living in Kenya, and any time they are unwell, get quick medical services. So there's a big gridlock.
I hear from you, Mheshimiwa Kitani, but first let's listen to Aden Duale, the Cabinet Secretary for Health. He spoke about what now appears to be what Senator Manzu is speaking about, some 10 billion shilling fraudulent claims that have been stopped. Of course, there's been several stories of people saying that this is the kiosk where a particular amount of money has gone into. Watch what the CS said.
Office on April 1st, 2025, we have intensified the fight. The primary function of our digital system is to detect fraud. We have seen that facilities are looking for innovative ways to cheat the system, but our digital architecture is designed to detect and flag anomalies at every stage of the claim process. 8 facilities in Mandera, 312 patients, we have the names of those patients, went through 8 facilities in one town, in one day, and making the claims to Social Health Authority. Nabwala Hospital in Bungoma falsified claims for multiple cesarean section on the same patient within days and supported maternity claims. In Kotiende Medical Center in Homa Bay, fabricated clinical documents with a single person signing off for both day and night shifts over consecutive days, which to us is humanly impossible. So this is a final warning that we are watching. Any facility, any doctor, or any patient to be involved in fraudulent activities will be held liable and will face the full force of the law.
So, quite shocking revelations there. But one wonders, Mheshimiwa Kitani, for how long has this been going on? And SHA has been in existence for close to a year now.
For a year now.
It's only now that we're hearing from the Cabinet Secretary, not even SHA. It's the CS speaking.
It's for a year now. And I remember, I think when we started, when we went into SHA, there were lots of issues, very many issues, because you know, we stopped a system and entered into another system. So now that we are in this system, we are slowly but surely getting the system to work and work properly. Now, my issue first, which I want to disapprove of what he has said, is that he said national government or the executive twists governors. The structure of devolution and the structure of the constitution does not give that room for twisting of anyone, because there are various levels of government, national and counties, and they meet both at summit and IBEC level.
But in practice?
No, let me finish. At summit and IBEC, and they also have council of governors where their issues are actually canvassed at that level. Now, coming to these particular medical services, again, he has said we have a committee of health in National Assembly, which he doesn't know what we do. One thing we need to appreciate is that healthcare is, yes, devolved, but there are functions or there are certain healthcare services that are not devolved. Level 6 hospitals and above are not devolved. They are actually run by national government, the likes of MTRH, Kenyatta National Hospital. All those are still at national, or they come to national level. And there are hospitals that have also upgraded from level 5 to level 6 and been handed over to national government. They need to be oversighted and they need to be followed through. And also, they need to buy medicines like everybody else. Coming to what Dwala has said, the system that was put in place under the SHA Act was to provide for an end-to-end service. When I go to a hospital and I get medical services, I provide my SHA. It then should say, I have been treated for malaria. I was given malaria drugs, I was given an injection, and maybe if I was admitted, and this is what I was done for. That information should go all the way to SHA, which is the administrator. And therefore, finally, when this hospital puts their claims together, my claim should be one of them, saying that I got this particular treatment, and these are the services I got, and these are this cost, because even the costs of these services are all agreed upon. So the cost of a CT scan, for example, has been agreed upon. If you go to MP SHA, which is a private hospital, or you go to a public hospital, you are told the amount that SHA will pay for a CT scan maybe is 15,000 shillings. So whichever hospital you go, you know that the cover is going to be 15. It's just that in national or public hospitals, that is the maximum and you cannot charge more. Private hospitals will tell you, because of our private service, we add up and above. And it is your choice as a patient to see whether you want to go add the above or go to the public hospital where you're going to pay the service. So when that happens, at the end of the month, these total claims should come saying this is the total that has been done. What CS Dwale has shown is how could he get this data? It is because there's a system that currently exists that tells you this particular patient, Marianne, has been charged this malaria or this injection 5 times on the same day, and yet it was only 1 injection, because the system itself has been able to flag that out, and when they are doing the claims, they are able to pick those up. If hospitals were honest enough, I believe we should not be having the delays that we are having in terms of claims being paid back to the hospitals for the hospitals to continue offering the service. And I would want to hear from, especially because now we have county governments here that are practically doing this service, for the claims that they put up, and because there is a system that says within a month or so, I think that was the agreement, after the claim is put, you should be able to receive your payments. For the claims that they put up, because they've told us what they've claimed so far and what they've been paid, but what has been approved, because there's an approval process that goes through to say these claims are genuine and these ones are not genuine. For the ones that are genuine, how long then do they take? Because then that should be the issue we need to be dealing with, to say, if claims have been clearly, they've been approved, they should then be paid within the framework of the agreement that is signed between the hospitals and SHA that says that you pay within this period.
You know, Sam,
yeah.
I would love to live in the world that Mheshimiwa Kitani lives in, where everything is working properly, where there are no delays in terms of disbursement of funds from the national government, where the governors are not twisted, where there is an end-to-end system of SHA that is working, and where claims are not denied, even the claims are processed within a month. That world is very good to live in, but it is not a practical world that we are living in as of today. That where governors are not twisted to sign various deals. Why? Because there is the practical application of how things are supposed to work, how things work versus how they are supposed to work under the law. It's the same claim that I want to pose to you, Mheshimiwa, where activities that are clearly devolved and functions of the county are being done at the national level instead of money being brought to the counties to do that. Up including the healthcare system in management of procurement of equipment, up and including the issues of in agriculture, which is farmer registration, or providing subsidies to farmers. Those are clearly county government functions. Providing AI and even including up including the medications that
you want to tell me that artificial insemination is is being conducted nationally?
When the Ministry of Livestock decides to do a livestock exercise across the country so that they can immunize the animals,
the vaccination,
which is vaccination,
Did
which
it happen?
is clearly a county government functions, and they are already making headway. They have provided money for it, which is clearly a county government functions that is devolved.
Sorry, I'm asking.
Yes.
Is vaccination of livestock happening in Murang'a today?
No. It's not happening at the national level the national government has yet to come to Murang'a. But it is already happening in other areas of the county.
So the national government is not doing it, yes. But is Murang'a County doing it?
Yes, yes. Murang'a County is already doing that. In fact, we had a program within the last financial year in terms of in several wards. We are not we do it from ward to ward, okay, so that it can be feasible for us to be able to do that. Mm-hmm. If the national government has the money to do it, why does it not release the money to the county but want to do those programs?
Because I remember it was the end of last year, CS Mutahi Kagwe talking about it and popularizing it after the president had spoken about it.
Yes.
So was there any discussions between Murang'a County and the Ministry of Agriculture, for instance?
You see, those are the conversations that Mheshimiwa Kitani here is saying that it's not possible to twist governors to go sign agreements at in State House or at the Council of Governors or even at the Ministry of Agriculture or the Ministry of Health, which happens each and every day. And what we are not going to accept is the scapegoating of governors, because there is clearly the national in the functions that are devolved. The ministries that hold those functions, which have joint functions at the national level, okay, they are supposed to limit themselves. And the Constitution clearly says in Schedule 4 that the county government functions what they are. What is left at the national government is policy level decision making. Implementation should be made at the county level. But what you find...
I'm asking, I am very particular in my question.
Yes.
Was there any conversation between Minister of Agriculture and the county government of Murang'a, Department of Agriculture, on vaccination?
No.
So, Senator Manzo,
yes,
what then do we do? Because 15 years later, with the Constitution empowering each level of governance and things are still being done as if we are under a central government, what do you do? Because you're supposed to protect the interest of the counties.
Well, first and foremost, we have tried very much when it comes to funding of counties. And unfortunately, the monies, the funding to counties have not been improved, have not been increased, and they should be. If you devolve health fully, and devolve agriculture fully, and even water fully, then you are likely to increase the amount of money is going to the counties. And not only that, you can see a simple thing like the fertilizer. It's still being done at the national level. You know, that's a county function. When it came to this immunization, it was a national government running with it. The president was even running around with the minister and the PS, Minister of Livestock, to different counties. And you can see not every county was covered. Some were abandoned. You know, as a governor, you see the national government has come to conduct vaccination. They are not even utilizing your local livestock people.
Makueni?
No, in Makueni it didn't happen. Because those days, you know, they were likely to get serious maandamano. But luckily, because what have you come to do in our county and you didn't tell us? You have not even mapped around.
Wind up on this.
Yes.
Did you see it?
But
In Nandi, sorry. In Nandi.
I don't know
Vaccination
what,
of livestock.
I don't know what he's talking about, but basically...
Humanization of livestock.
No.
We did it ourselves as a Makueni, but not...
But what basically I'm saying is that the Constitution itself also provides for where functions, even though they are devolved, are being provided across the country, there is a uniformity that is provided for. And I think even Senator Manzo will tell you that there are even bills that we have passed that allows for counties, for uniformity in terms of, like in terms of charging of revenue, in terms of certain functions. And where, like, for example, the fertilizer issue that you've mentioned comes about, national government can negotiate a price or negotiate for fertilizer and be able to give that fertilizer across the whole country, so that
the Constitution does not allow that. The Constitution allows for you to make a policy.
I don't know
for
what
example, you
Constitution
make
is
a policy
talking about.
of subsidizing fertilizer at 2,500 shillings, which is very fine. What is supposed to do is provide that fertilizer at the county level. The county is supposed to take the responsibility of taking that fertilizer to the farmer in a manner that is conducive and towards the responsibility of the farmer.
And which is what has happened, because fertilizer has been brought at 2,500. It's been brought to NCPB, and the counties are supposed to pick from there.
They are not even aware that those fertilizers come to the ground.
They have been told. They have been told. They have had meetings at the summit level, and they have had meetings at all levels. Because I am aware of that, because I know when the president walks around and he says, and the governor is there, he's told, have you been able to pick fertilizer? And he says yes. But the truth is, even if you go to my village today, the fertilizer is at the headquarters, and it is not in the various sub-counties or wards where the fertilizer is supposed to reach every mwananchi. Coming to the issue that you've talked about immunization and about the AI services and all, those are services that counties are supposed to provide. But when you go to the ground, we are animal keepers. They are not there. They don't provide those services. So what happens? Because at the end of the day, in terms of the vaccine that is given, there is a national institute that looks at the type of vaccines that come. Are they good for animals? Because, again, there has to be a uniformity across the country to ensure that whatever vaccines that you're going to bring into this country or you're going to administer is not going to affect the health and the people who are supposed to receive these services. And for that respect, you cannot say Murang'a County will do its own, Nandi County will do its own, Machakos County will do its own.
That's what devolution is all about.
Then you bring in a national vaccine. Then after that, give it to the counties for them to now be able to administer to its...
Part of why the devolution is all about each county doing its own thing is because the requirements per county are very different. Because the animals in Murang'a and what are required in the animal husbandry in Murang'a is not the same as Northeastern. It's not the same as Makueni. It's not the same as... and I want you to look at Schedule 4. Schedule 4 of the Constitution, because you are a member of Parliament and you are supposed to clearly understand the Constitution, so that when you are making law and policy at the national level, you look at Schedule 4. It clearly states that part of the schedules of the national government is agricultural policy. Agricultural policy, veterinary policy, health policy. That's at the national level. When you go at the county government